At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Putting Your Best Foot Forward on Wednesday, April 29th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome. This is Dr. Tom Roselle. You're listening to Ageless Health with yours truly, as you do every Sunday in the Washington metro area on 105.9 FM WMAL. You know, we've been talking about an interesting platform, and I say that as part of the program, platform meaning your feet. And it's a program that we're going to be doing this coming Wednesday evening, the 29th, 6 p.m. at the Roselle Center for Healing in Fairfax. And I promised you a very special treat. And what I meant by that is that we have the professor that's going to be presenting that, Dr. Harlan Browning, who many of you know is amazing. And I've had the privilege of being with him for a whole bunch of years, and you know, to the point where we both forget time and frame. But when it comes to information, when it comes to data, there's nobody better. We're going to be talking about your feet today, and we're going to talk about how they can predict pain patterns and even things that your feet don't feel good. You know, those dogs that you're walking on, you know, remember the old song by, I think it was Nancy Sinatra or something like that. These boots are made for walking. Well, those feet are made for walking, not having to put tons and tons of stuff underneath it. But having said that, let's get into the program since we got a kind of a short venue with you. Dr. Harlan Browning, welcome, buddy.
Hey, Tom, good to be here. It's been a while, huh?
I know it's been a minute, kiddo. I'm glad that you're back on with me. We're going to have some fun going forward with this thing. Listen, we're talking about one of the things that you're amazing at, and it's diagnosing foot pain and foot problems, and seriously how it affects everything else neurologically in the body. This Wednesday evening, you're going to be the keynote. I'll be there to kind of give you moral support and interject a few things on a biochemical platform. But it should be fun, and I want people to know that they can join us simply by either going online at rosellecare.com, that's rosellecare.com, and register. And all we ask you to do is, if you can't make it, call us the day before and say, hey, we can't make it, so we can put somebody else in place. Or you can call the office the old-fashioned way, 703-698-7117. Harlan, let's get into this a little bit and talk about that, the connection, if you will, from the foot and the rest of the system. You know, why is it so important? You know, you're the master at this thing, to look at the feet in any type of, whether it's a pain pattern, that's the foot itself. What's normal, what's not, why is it important? Let's go from there, and then we'll play with it a little bit.
You know, I think, first of all, no pun intended, if you take a step back and you look at the way we walk, we call that gait. It is so important for the neurological system, number one. So we underestimate what we do when we walk. So if our gait is not of good quality, let's just call it that, then we can certainly have your typical things, your aches and pains in your foot. But what we often will see is an overall degrade of the body itself, the neurological system, the chemical system, the postural system. So, you know, the presentation we're going to do is about kind of the holistic effect of of gait and upright posture, because that's really what it's about as well. It's, how do we stand upright in the gravitational field? And then what happens when we start to break down, and the symptoms and the signs that we see. So it's going to cover a lot of different things, but ultimately people want to know, why do my feet hurt?
Doc, listen, so when you look, a patient comes in and, they're complaining that their feet hurt. Is it something that is initiated there, or is it a structural neurological problem that is more prominent further up in the system? What comes first, the chicken or the egg, and how do you distinguish between the two?
I don't know if we can really answer that. I think it's safe to say sometimes it's the chicken and sometimes it's the egg. So what kind of carries over between the foot and other areas of the body that cause the foot to have issue is the integrity of the joints in our body. That's really what it comes down to. How good of integrity do we have in the joints, and how do the muscles help to stabilize those joints and move those joints? So just like you're alluding to, sometimes the foot problem can be because we have a hip issue that we don't know about. Maybe it's the way we hold our hip. Our hip is turned out too much because we have too much tightness. Well, unfortunately, we're going to step differently. And over time, that can culminate with the person having something like a plantar fasciitis.
So patient comes in, let's play the what if game. If patient comes in and they see you and they say, Doc, my feet are killing me. My legs hurt, and you ask them, how long has it been there? And they tell you it's been, a while. And so how do you begin to distinguish what's taking place? What are the possibilities that may be a problem? Our listeners are out there saying, yeah, my feet hurt all the time. But where do you look? What's first? What's next? What's relative to diagnostics? How do you put the pattern together?
So you need to tease some things out to figure out, I think, to answer your question, if it's a primary foot problem, you have to look at a few things, but I think the most important thing to start with is you just talk to the person. How long has this been happening? Was there an injury? What makes it better? What makes it worse? So, the longer you let the person talk, the greater likelihood they're going to tell you what the problem is, which is going to make my job and your job a lot easier, which is giving them a diagnosis and a treatment plan. So, but other things that you could look at is, what's their upright posture like? Do they stand completely upright? Do they have a tendency to shift to one side or the other? What does their gait look like? And then certainly the deeper dive into how well the joints of the foot move, and the pelvis and the hip and the muscle integrity. Do we have good strength at those joints? Do we have too much tightness in the muscles? These things all come into consideration when you come up with your diagnosis. And what you ultimately find is you're often treating across different structures. Some of your treatment's going to be directed towards the foot, some is the pelvis and the hip. So if for the best outcome, you're going to treat globally.
So, patient comes in and they take their socks off and you look at their feet. And one of the things that we do in our practice is we do something called a gait scan, where we have them walk across the pad so we can see the mobility, the acceleration, the deviation of how that foot's supposed to hit. And it has to be done in a weight-bearing position. Otherwise, it's really inconsequential, in my opinion. But when you look at that foot with and you're seeing a dropped anterior arch leading to pain in that area, and when they hit, they get the sharp shooting pain. You could call it a Morton's neuroma, or you see that big old knuckle, if you will, on the big toe. What are some of the causes of that when a patient comes in? Number one. Number two, is it treatable? What do you have to know about those things?
I think the number one thing that people need to be aware of is the type of shoe that they put on has a huge impact in the way their foot works, and ultimately that's going to affect their gait. I will say this, you don't see as many people, especially ladies, wearing high heels anymore. So that's a really good thing. So number one, when you wear a high heel, it's going to elevate your heel off of the ground, which is going to change the way your calf muscle works. And the secondary effect is it causes you to slide forward in the shoe. Well, most high heels have a very narrow front part of the shoe, which we call a toe box. So that's the double whammy. We're lifting the heel and then we're jamming the shoe into the front part, which is basically like a triangle. So everything gets squished. We don't see people in heels as much. So I think that that's a good first step. But that doesn't mean that the shoe that they're wearing is what they should be wearing. In other words, some people, they see an advertisement, they like the way the shoe looks, and then they read the reviews and they assume it's a good shoe for them, but sometimes it's not.
So each foot, if you will, is not the same as everybody else's foot, regardless of how close it is. It has to be specific for them.
Yeah, they're very similar, but they're nuanced. So I wouldn't say it's as unique as a fingerprint, but certainly it's not there's not like 3 shoes that everybody could use kind of routine.
People run off to the podiatrist because they've got that big toe deviating to the inside or to the outside, and you got that big old knuckle that's forming medially. What causes that? And number one, number two, is it reversible?
So most foot issues happen because of a lack of integrity of the arch. So in your foot, you have basically 3 arches in the foot, 2 that go from front to back and 1 that goes from side to side. So as we lose the ability to maintain that arch when we walk, then the rest of the foot is going to compensate. So in gait, we talk about something called supination, and then the real famous one is pronation. So both of these things should occur. We get very focused on that term pronation, which means that the foot flattens. Well, flattening of the foot when we walk is normal, but we don't want to excessively flatten or stay flat for too long during that gait cycle. So that really gets the ball rolling as far as people who get bunions like you're referring to, or a neuroma or metatarsal pain, heel spurs, all those things. So if you can maintain the integrity of the arch, typically that helps you correct a lot of these underlying problems.
When somebody has a flat foot, and obviously with a flat foot, they've got that pronation you're talking about, the arch is collapsed, if you will. So is it going to happen on both sides, or is it one side more so than the other? Is there anything based on handedness or postural patterns, or is it from an injury?
You certainly can have injuries that cause more pronation. In other words, a person, if they repetitively roll an ankle, invert it, that's like the outside of the foot rolls under, then that's going to change the whole mechanism of gait. The one thing that's happening in the background that is very important is all of our joints have what we call proprioceptors or mechanoreceptors in them. These are little tiny kind of machines that measure amounts of pressure and where we are in space. And every time we either injure a joint, we torque it and we stretch it too much, or we compress it, or the joint doesn't move, then these mechanoreceptors don't know what's going on and they give us bad input. So the issue with repetitive traumas of the ankle is very often the nervous system gets creative and comes up with a new rules of engagement, which often is poor gait and poor upright posture, to be honest with you.
Interesting thing, and it's we know about it in the world that that we practice in. Our specialty group is one that's based in the fundamentals of something called applied kinesiology. That just means the muscle function related to something else in the body. Flat feet will cause all kinds of problems throughout the body. And the interesting thing, in which what most other physicians have no idea unless they're in our world at all, is that if the talus drops down, one of the things that it can show is an upper body problem as well. And I don't want to talk about upper body problems. I know you're going to get into that this coming Wednesday evening, how the hip bone connects to that, the knee bone and so forth and so on. But if that talus drops, they could have weak neck muscles, and the neck muscles subsequently, if they're not holding, not stabilizing, that they can cause neck and shoulder pain as well. So you have here this lower platform causing an upper problem. So my question to you is, if that's can go that way, can a higher problem, neck and shoulder and head problem, cause the feet to be a problem.
Yeah, absolutely. So when we have poor movement, especially because of injury or trauma or because of pain, then we often become what we call antalgic. Antalgic means that we just change, we shift our posture, we move around to accommodate the issue. The best example would be a person who has back pain. We all have seen these persons. They get out of the chair, the hip is going to the right, the shoulder's going to the left, they're halfway bent over and they're twisted. Well, there's people who go through life in these antalgic postures. And when that happens, that means that the nervous system and the muscular system has to rewrite everything. And that ultimately will change our posture. So if we have a shoulder issue and we're holding the shoulder too far forward, and that changes our center of gravity or our center of mass, then we're going to acclimate by changing what we do in the lower extremity to prevent us from falling. That's really what it comes down to. The body doesn't want us to fall. Well, that might not be economically good because we're using more energy, okay? And ultimately, we're going to distort other joints in the body, which can cause them to become more lax and loose or whatever you want to call them. And that can lead to that pronation, that flat-footedness. So yes, upper body stuff can manifest as lower body over time for sure.
Yeah, that it's an interesting. You and I have dealt with many high-level athletes over a period of our careers, and one of the things that I've seen with these monsters, if you will, the guys that have played in the NFL, a lot of the NBA, and so forth, is that their upper body becomes discoordinated someplace because their feet are bad, but also their lower body becomes less coordinated in their ability to move because they're compensating for an upper structural problem. And then all of a sudden pain shows up and everybody focuses in the pain area instead of coordinating and putting together the why behind those triggering mechanisms. This Wednesday evening, I want to remind our audience that 6 o'clock at the Roselle Center for Healing in Fairfax, you're going to be our keynote. We're going to be talking about the feet, and we're going to be talking about how it affects pain patterns, where it comes from, but more importantly, what can be done about it briefly. And I don't want you to give your hand away, but we're going to be, the class is entitled Putting Your Best Foot Forward, but it's about the foot-body connection, if you will. Everything that is this puzzle, this ankle bone connected to knee bone to the hip bone and so forth. And it's really significant in this particular pattern. If you're in pain, my friends, this is a program that you don't want to miss because Dr. Browning is amazing at giving you things that you can do on your own, and he's going to show you those things. We're going to point out stuff. I'll show you some biochemical pieces that relate to your feet as well, and you're going to go away with a ton of information. But having said that, without giving your hand away, Doc, what are you going to cover this coming Wednesday evening?
You've seen my presentations, especially the ones that are mechanical in nature. I almost always start with basic anatomy and biomechanics. If you understand the way we're laid out and the way things work, it's not that hard to understand why things go wrong. So we'll certainly talk about the mechanics. I'm going to touch on the most common things that people will see in their foot, because I would assume a lot of the folks that are going to show up are there because their feet hurt, not so much their back, but even though that the back problem can be because of a foot problem. And then ultimately, how do we figure out what the primary cause and the secondary cause is, and then what we can do about it so you're going to stop taking the Advil. You don't have to keep getting the latest and greatest orthotic. You don't buy the next best shoe, all of these things that people do over and over again, and it doesn't really help that much.
No, and it's if you don't treat the cause, if you don't get into the why is that, then your whole body suffers because of it. And it has to start with the mechanical base. It's like if you have a crack in the window on the second or third floor of your house, and you go in and you replace the window, but it continues to shift and you can't, pretty soon it doesn't fit the way it's supposed to. You're trying to solve the problem, but the problem is not necessarily the window. It's the foundation.
Absolutely. I mean, it has so much importance as far as everything that we do in life. And I think sometimes we just look at the walking aspect, but if you don't have the ability to stand upright with good posture, then anything can just degrade, and it can go down fast.
How often does, in the scope of 100 cases, 100% of all the cases that come in for back pain, how many of those have a foot-related problem that either is making it worse or initiated it to begin with? Just, I know you can't give us a absolute, but in your history of practicing over the decades that you've been in practice, what would you guess?
Because we do a lot of muscle testing in that applied kinesiology field that we specialize in, the number I would say would be close to 100%, in as much that when you start to test muscles of the lower extremity, all the way down to the foot, the ankle, and all that stuff, you're almost always going to find weakness there. So does that mean it contributes 100% to the problem? Probably not, but it's certainly going to, increase the issue. So it's almost 100% prevalent, but it doesn't necessarily mean it's 100% of the problem. But you certainly always want to check those foot muscles when you have low back problems.
So let me ask you a question. Can you fix a low back and spinal problem so it stays stable without fixing the feet?
Well, that is the $1 million question, because there are many situations when the foot problem is coming from the back. Yep. So I guess it's safe to say, can you fix a foot and or a back problem without addressing each of those components? It gets harder to do that.
Got it. And that's what I wanted our audience to hear, because you've got to look at both of those pieces. But, listen, folks, this coming Wednesday evening, this is an opportunity for you to really understand the puzzle, the matrix, if you will, that makes you who you are relative to how things work, how they begin to develop in a bad way, but also how they repair themselves in the path that you should be taking. And you're not going to learn from anybody better than Dr. Browning. He's, I guess I'm very humbled anytime I've had the opportunity to sit with him, because I always learn something. And a few months ago, there's an amino acid that we use over the years for weightlifters and so forth. And I'm sitting talking to him, and nonchalantly he said, "Hey, have you been using creatine?" And I said, "Yeah, for, blah, 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 blah." I said, but he says, "No, that's not it. And by the way, if you come on Wednesday night, I'm going to let him tell you about creatine, because if you're having any problems whatsoever with memory, like you forgot what you did with the keys, or, you're over the top and everything's it's a situation where you're going to be surprised. But we'll save that for you if you come Wednesday evening, and I'll let him open that up as one of the pieces of the puzzle that you should really be aware of, because actually it does have an effect on foot problems as it relates to the muscular components that affect the feet and so forth. But and I found that out, Doc, after I did a lot of deep diving after that, because you had my head spinning. But we'll talk about that when you come. But give us a call, 703-698-7117, or simply go online at rosellecare.com and register for the class. I promise you we're going to have a lot of fun. We always do. But you get the opportunity to listening to somebody who I have tremendous respect and admiration for. That'll be a fun night. The 29th, April 29th, this coming Wednesday evening, we're going to start doing our in-house programs a little bit more often. We want to give you more data. We're going to start having our docs on again, and other personalities that I think that you're going to be very pleased with, relative to what we've got cooking, things that are happening in our practice relative to expansion. So join us, and we might give you a little bit of a hint on some of that this coming Wednesday evening. So join us, rosellecare.com, and don't forget to follow us on all our social media sites. We're everywhere, Facebook and Instagram, and you name it, X, we're there. So check it out. Doc, I'm looking forward to this Wednesday evening. It's going to be fun.
Yeah, it'll be real fun.
You're always a wealth of knowledge. We're coming up to the end of the program, and we'll continue. Don't forget to follow us on our podcasts. We're going to go do that. You can go to drtomroselle.com and link it in. Anyway, we're here. We'll be there, and we'll see you on Wednesday night. Remember, I'm here every Sunday for one reason only. I love you all. Have a great day.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Putting Your Best Foot Forward on Wednesday, April 29th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.